As of 2023, nearly 1 million individuals are currently receiving in-home care in the UK. Projections indicate that this figure is set to double over the next 15 years. According to a survey by the Department of Health and Social Care, a significant concern among individuals in care is the occurrence of UTIs.
UTI stands for urinary tract infections.
This is Dr. Tang, a GMC registered GP.
Normally infections come from the skin surface or the bowels, so any of the bacteria that goes through the tubes to the bladder will proliferate, and that could cause a bladder infection.
Whilst UTIs cause mild problems for young adults, they have more severe consequences in seniors. New data by the NHS shows that UTIs have led more than 800,000 hospital admissions across the UK over the past 5 years. Last year, there were over 147,000 admissions with primary diagnosis of a UTI, and over 50% of those were over the age of 65.
But UTIs can be dangerous because if it's untreated, it can spread towards the kidneys to upper kidney infection, and then that could be quite serious. It can cause sepsis, it could end up in hospital. Especially if it's an elderly patient, they can have severe consequences.
They can lead to kidney failure or sepsis, a life-threatening infection of the blood. UTIs often go undetected in care settings. This can be because symptoms in elderly people can be very different from symptoms in younger people.
With elderly patients, they can get alternative symptoms compared to young people with confusion, falls, incontinence. It's probably due to reduced immunity, multiple medications, multiple pathologies. It just confuses the picture. So elderly people are more vulnerable to just ordinary infections like urinary tract infections compared to young people. So they get a multitude of symptoms.
They can even be painless. These are known as silent UTIs. So, how can you detect if someone you are caring for has a UTI?
They may have the classical symptoms that young people and older people get, which is like a pain on passing water, passing too much water, urgency. They may get some back pain, abdominal pain, maybe fever. And then they may have some more atypical symptoms that you find in older patients with confusion. There may be falls, there may be dizziness and sickness.
What to do if you suspect that someone you care for has a UTI?
If the patient is well without a fever, eating and drinking, talking, then contact your local NHS practice for GP to come out for assessment. If the patient's feeling very unwell, high fever, dehydrated, very confused, it's best to call 999.
There's also another issue with the high rates of UTIs in the UK. Apart from the dangers to the individual upon diagnosis of a UTI in a patient, antibiotics are typically prescribed. However, UTIs are contributing significantly to a growing burden of antibiotics becoming resistant to infection in the UK. Shockingly, 1/4 of samples analysed in the first half of 2023 revealed bacteria resistant to a commonly prescribed antibiotic for UTI treatment.
If you use antibiotic too much, the bacteria will adapt, and then the antibiotics won't be effective anymore. So overall, we want to reduce the resistance or control it so that we have more antibiotics to use in the future. But if we've got a world with not a lot of antibiotics and a lot of resistance, then we can have serious problems in the future with treating simple infections like chest infections, urinary tract infections.
Another issue that could arise is misdiagnosing UTIs due to the use of dipstick tests. Dipsticks often fail to differentiate between harmful bacteria causing acute infections and those that are innocuously presented in the urine. Consequently, patients may receive antibiotics unnecessarily due to the misdiagnosis, leaving a potential side effects and exacerbating in the development of antibiotics resistant against infection. It's not all bad news. We can do things to prevent UTIs before they even take hold.
Drinking enough fluids, at least 2 litres, 3 litres per day, that will help to keep the urinary system flowing. They can do like fluid charts, they can calculate I record how much food they're taking in. It's just general encouragement to get them to drink more. And you can check the urine. If the urine is looking clear, they're not thirsty, they're not looking dehydrated, then that's a good sign.
Staying hydrated not only helps prevent UTIs, but it's good for your health and provides us with a crucial advantage in the ongoing fight against antibiotics becoming resistant to infection. The future is looking bright for UTI treatments with the development of a promising vaccine. In a recent trial, over 54% of men and women with recurring UTIs remained infection-free for 9 years post-vaccination. To follow our campaign on social media, use the hashtag UTIaware. We are Homelium, an in-home care company that provides essential help to people who require care in their own homes. If you are caring for a loved one now, know that we are here to lend a hand. We understand that not everyone has the means to access external assistance. Our aim is to equip you with the knowledge to navigate the daily hurdles you may encounter as a caregiver. To find out more, visit homelium.com.